This is Channel 2 News, coverage you can count on.
It's very important to get a measles vaccine.
The number of people in the U.S. infected with measles is growing, and health officials are urging everyone to take preventative steps. The symptoms to look for and how to protect yourself and your family, as Health Watch tops Channel 2 News at 6:30. This is pretty scary. Right now, the CDC reports 68 cases in the U.S., 11 different states, in fact, including now one in southern Nevada. Good evening. I'm Kristen Remington.
I'm Wendy DeMonte. Thank you for staying with us tonight. Of course, this outbreak is causing concern among parents as well as health officials alike all across the country. Ariana Bennett joins us out live in the newsroom with what we all need to know. Ari?
Well, first off, it's important to note that it is very rare to die from the measles, but that doesn't mean it isn't cause for concern. It is very contagious and does have a high rate of complications like issues with eyesight, hearing, and pneumonia. And while it was declared eradicated in the U.S. about 15 years ago, it's still very common in other countries.
Because we have so many travelers coming into the U.S. that bring the measles with them, they put everybody else that's not vaccinated at risk.
Now, the measles vaccine is included in the standard MMR, or measles, mumps, and rubella vaccine that most people get as children here in the U.S. But in recent years, the rate of vaccination has dropped, creating pockets of unvaccinated people who are susceptible to the virus. Right now, there are 2 reported cases in Clark County, which caused dozens of unvaccinated children to be kept out of school in order to stop the spread. Health officials here say it's never too late to get yourself or your kids vaccinated.
If you haven't received the vaccine or haven't had your children vaccinated and a traveler comes into the United States that's been in a country that has had measles, you put them at risk as well.
Now, the symptoms of the measles are fever, rash, congestion, coughing, and red or runny eyes. Now, if you experience these symptoms, you'll want to call ahead to your doctor before going so they can take precautions to make others aren't exposed. And if you're not sure if you've had the vaccine, you can find out by getting a blood test. Covering Health Watch live from the newsroom, Ariana Bennett, Channel 2 News.